My name is Cecilia Alcala, and I'm a postdoctoral fellow at the Icahn School of Medicine at Mount Sinai. And I just want to say it's truly an honor and a privilege to be with you all this morning at the Meharry Medical College. Actually, 7 years ago, I came as a PhD student under Dr. Maureen Lickfold to conduct my first environmental health literacy scale on this campus. So this is truly a full circle moment, and as you'll learn later, my life is truly full of full circle moments. So today I will be presenting to you all on environmental justice, the exposome, and health literacy. So I will first briefly introduce myself and my journey in the environmental health field, and then I'll discuss environmental justice, the exposome, health literacy, and the importance of translational science, and end with a reflection. So I am a daughter of immigrant parents from Haiti and Trinidad and Tobago, and I was born and raised in Brooklyn, New York, as you can see my parents here. Sorry, Mom. So growing up, my mother was a blood bank supervisor at a Brooklyn hospital, and I used to go there unofficially after school, and that's where all of my questions about public health and science began. I would always ask her, who needs blood today, and what their story was, and most importantly, how did they get sick? And as you can see in the middle here, I was born with a congenital heart defect called tetralogy of Fallot, and used to always ask my cardiologist, pictured here, Dr. Richard Golinko, actually at Mount Sinai, and I would ask him questions about how did I get this condition, because no one else in my family has heart disease. And he would always explain to me that there are multiple factors that led to my condition, including the environment and genetics, but could not answer my question. I always thought to my mom, like, okay, he's a brilliant man. If he can't answer it, there's something going on, and it must be the environment. So growing up also in Brooklyn, I also saw how low income and minoritized communities were disproportionately impacted by the lack of green spaces, food deserts, and toxic chemicals. So these life experiences led me to a career studying environmental exposures and developing effective translational strategies to improve health, specifically children's health, particularly those from low income or racial ethnic minoritized backgrounds. And on the far left, you can see a picture of glyphosate and of a Surinamese man working on his farm, his backyard, and that's how he sells produce to provide for his family. So I did my dissertation research in Suriname as a Fogarty Global Health Fellow. So for environmental justice. So as Dr. Robert Villett and many panelists and during our sessions yesterday have already expressed, that environmental justice is defined as the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, respect to their development, implementation, and enforcement of laws, regulations, and policies, and that affect their environment and or public health. And since its inception, the environmental justice movement has been leading efforts to document environmental exposures and health conditions that reflect the values and the needs of marginalized impacted communities. So this table showcases the 17 principles of environmental justice proposed at the first National People of Color Environmental Leadership Summit, which resonates strongly as it did today as they did in the 20th century. So the principles of environmental justice precede the 1994 federal executive order in the US, which called for the integration of environmental justice in various branches of the government to serve minority and low-income populations. So over the years, community-based environmental justice organizations have built power, environmental justice scholarships have grown, and tools to assess and identify environmental justice communities have been developed, and research programs dedicated to combating environmental injustices have increased. So I want to take a little step back, and I want to talk about population. So as research scientists and clinicians, we always talk about our populations, our study populations, or our targeted populations. But I want to take a step back and remind us all that we are all a part of diverse group of communities and in our everyday lives. And with that, we also work with these communities. So a community is a group of people who share something in common. So sometimes a community can be defined by a place where people live, work, or play. They can be by their identity, maybe externally assigned like race or internally defined like religion. It can be by affinity. something people like to do or do together, and their affiliation, people you know, experiences you shared, and the values you hold in common. So environmental racism was a phrase coined by the civil rights leader, Dr. Benjamin Chavez Jr., and he defined it as the intentional siting of polluting and waste facilities in communities primarily polluted by African Americans, Latinx, indigenous people, Asian Americans, Pacific Islanders, migrant farm workers, and low-income workers. And numerous studies have shown that these communities are disproportionately exposed to fumes, toxic dust, ash, soot, and other pollutants from such hazardous facilities located in their midst. And they face increased risks of health problems like cancer and respiratory issues. And Dr. Bullitt actually expanded the definition of environmental racism to any policy, practice, or directive that differentially affects or disadvantages where intended or unintended individuals, groups, or communities based on race. So there's a lot of examples of environmental injustices that we've talked about while we've been here that we're all aware of, specifically the lead in Flint, Michigan's water, as you can see here, the toxic petrochemical plants in Louisiana's Cancer Valley Alley, the oil and gas projects that overburden some U.S. tribal reservations, and right at home in New York City and Brooklyn. I live in Bedford-Stuyvesant, and I actually found that 2.7 miles away from me, there's a waste management transfer station in Bushwick, Brooklyn, which I'm not sure if I can do this, but that gray spot, I don't know how to work this, but the gray spot there where you can see the basin, that is the waste management station, and you can actually see the color-coded of the different differential groups that are impacted. And in 2021, there were 1.3 times more Hispanic residents in Bushwick than any other race or ethnicity. So those are all a few examples of environmental racism. So for exposomics, as we all know, the exposome concept was initiated from the field of epidemiology, and the term was coined to encompass a totality of human environmental exposures from conception onwards, complementing the genome. And the concept was developed to draw attention to the need for better and more complete environmental exposure data in order to balance the investment, tools, and knowledge in genetics. So the framework includes 3 overlapping domains within the exposome, which include general external environment, which includes factors such as the urban environment, climate factors, social capital, and stress. Specific external environment with specific contaminants, diet, physical activity, tobacco, infections, and the internal environment to include biological factors such as metabolic factors, gut microflora, inflammation, and oxidative stress. So adding to another dimension of exposomic is anthroposomics, which a few of my mentors have established and developed over the course of the past couple of years. So I've provided here the anthroposomics framework, which draws on the life science omics terminology to emphasize the importance of including fine-grained studies and human activities in exposome research. So anthroposomic research reveals how people sense, know, reject, mitigate, and transform exposures in their everyday lives, and in effect, adding the arrow back as shown in this particular figure. So understanding the toxicities that matter to people, how they seek to avoid exposures, are the points of departure for health interventions that seek to prevent exposures. So while larger political and economic structures shape exposures, people are not just the victims of their uneven exposures. In their daily lives, they seek to protect their health and improve their environments while maintaining communities that provide them with the means to survive, perhaps even flourish in a polluted world. So linking environmental racism and anthroposomics, these are low-income minoritized communities that might be impacted by a lot of these environmental and social exposures and stressors, and most of them are happening synergistically compared to their other counterparts. So in this proposed research study titled A Community Partnered Approach to Assessing the Impact of Prenatal Pesticide Exposure on Child Respiratory Outcomes, we will actually assess prenatal pesticide exposure and the association to lung function and asthma and VEs in children within the Programming, Research, and Obesity, Growth, Environmental, and Social Stressors cohort based in Mexico City. And we will utilize the Anthroposomics framework for the first time to conduct focus groups to learn more from the mothers about their relationship with the use of pesticides and household risks, to assess knowledge, attitudes, and behaviors of using pesticides. We will then use this information to create an environmental health literacy scale to assess the activities of pesticide use and household risk, not just with the mothers, but also the children as well. And we will also disseminate our research findings through appropriate outreach materials that we will work with community organizations in Mexico City, stakeholders, and experts in the field for both the mothers and the children. So environmental health literacy is an area of study that combines elements from different disciplines, including health, literacy, risk communication, environmental health, communications, research, and safety culture. It focuses on an individual's understanding and use of information about potentially harmful environmental exposures and how these exposures influence health. It comprises of a range of knowledge, attitudes, and behaviors that influence how individuals and communities use environmental information to make decisions about their health. And EHL is specific to personal and community contexts and the contaminated environmental media involved. And the environmental media refers to the parts of the environment which include soil, water, air, plants, and animals that can contain contaminants, potentially resulting in individual or community exposure. So the use of EHL has been shown that with education, we can effectively communicate environmental risks, has shown to positive impact in protecting communities disproportionately exposed to environmental hazards. So this figure by Dr. Kathleen Gray suggests that awareness and knowledge are an important starting point for EHL, and when combined with information, seeking, and decision-making skills and self-efficacy for specific behaviors such as knowledge, can inform collective action and community change. So this EHL can be conceived as having 3 dimensions, and each of which builds upon the next. So starting with awareness and knowledge, providing broad recognition that environmental exposures and sociocultural dynamics actually influence health. And this awareness may reflect a more general understanding that environmental exposures interact with biological processes to cause negative health outcomes. And then with the skills and the self-efficacy, skills that enable health, protective decision-making, and self-efficacy associated with those particular skills. So for example, the ability to find and understand the scientific information, or the ability to participate in community decision-making, or the ability to take steps to reduce environmental asthma triggers in a home. So lastly, community change or collective action is used to reduce or remove harmful environmental exposures. So both individuals and group apply their knowledge and skills in the context of self-efficacy for the desired behavior change to reduce harmful environmental exposures and improve health. So with environmental health literacy, we are understanding why people make these decisions and what are their attitudes and behaviors pertaining to chemical exposure, and how does their knowledge of associated health outcomes impact their decisions, which is why translational science is a necessity. So as environmental health researchers, it is tradition that in order to translate our science, our immediate goals are to publish that manuscript and present an oral or poster presentation at a conference, which I love, I'm right there with you. But in order to inform and gather our research, when we do that, it's essentially limited to our coworkers, our peers, right? So we're not essentially getting the message out there to the populations we serve. And I say the populations we serve because this is why we all do this work. And whatever grant you apply for, you're saying, I want to reduce these chemical exposures, I want to improve optimal health outcomes. So we serve these particular communities. So I challenge you all to think about your science and how you can translate your work to the populations you serve, not the populations you work with, right? So we're translating science is the process of turning observations in the laboratory, the clinic, and the community into interventions that improve the health of individuals and the policy and the public. And we can do this in so many ways, and here are a few examples. So to encourage a rapid and pervasive adoption of the 17 principles of environmental justice and exposure science, I collaborated with colleagues to propose a logical framework of 10 concepts that can serve as a roadmap for redefining how to conduct exposure science in a more just, inclusive, and equitable manner. So I want to draw your attention to the inner circle here, where we can highlight and focus on sustainability in order to build capacity, to ensure our research questions are set by those affected, and measuring contaminants is culturally and ethically responsible, and science communication and results dissemination is a priority. So while it is recognized that each research study is different, and more importantly, each community is likely to have unique political, cultural, environmental, and/or social characteristics that affect their exposures, herein we distill and focus on a framework that transcends specific research questions or communities, and aim to provide a path in which exposure science can actively engage to reduce environmental injustice. So community science, the practice of community-centered strategies, tools of science, and local knowledge systems to document and address environmental injustices. And some fundamental principles to community science are that frontline communities inform each step of the research process. It is rooted in authentically and just partnerships that draw upon cultural and spiritual traditions of particular regions or communities. And the methods of science are not just available to the scientists, but they're available to everyone. And it focuses on empowerment, not empowerment, but empowerment, the focus of activating the power that the community members themselves already behold. So we can utilize the community science process by first organizing and maintaining the partnerships that we hold with those particular communities. It shouldn't be the first time that we're meeting the community members is when we already thought of that amazing research question and now we need their help because we need them to abide and help us, right? So we want to identify their concerns and their needs and their strengths. And then we want to prioritize the community's concerns, and with that, then develop research questions and create data collection plans and develop training to collect data. And then in order to increase sustainability with our research, we want to train community leaders and partners. We want to conduct data collection and then analyze and interpret our data, but share our results with communities and decision makers and develop action plans as well and establish mechanisms for sustainability throughout the entire research process. So historically, exposure scientists and researchers have assumed the science speaks for itself attitude, a perspective perpetuated by the dissemination of research primarily, like I said, through manuscripts and conference presentations. But in our environmental justice framework, it is important to ensure that the communities being studied become part of the dissemination strategy as well. So translating exposure science data into accessible knowledge that can inform community actions and interventions is valuable and necessary. So sharing research results with the community is essential to increase knowledge within the communities and promote evidence-based policy for optimal health outcomes. Remembering that dissemination through co-learning approach that may include translation of materials and development of clear messaging around results and guidance on actions to reduce exposure of concern. So this particular model for communication and results dissemination focuses on two priorities: the target population in the community and the specific community, the scientific community as a whole. So here are some approaches that I've already talked about already, but the community once again should receive research results before they are disseminated to the broader scientific community. And science should be able to interpret and present their findings to the communities they serve as well. And they should be able to collaborate with community stakeholders before and during and after the research study. And we should be able to understand the target populations that we serve, including the neighborhood resources that they already already have, and the structural and community factors that are associated with the research topics as well. And within the scientific community, in addition to publishing concise and informative articles, we should be able to coordinate and produce webinars and workshops that not only target our peers, but also the community members as well. And we should be able to collaborate with policymakers to influence policy development and modify current policies. So with any research, we always have our challenges, which may include funding as well. Institutional buy-in, I know like a lot of institutions, they might have specific structures wherein you are trying to do transdisciplinary work as well. I also believe it starts with the curriculum. Our public health curriculum as a nation right now doesn't really enforce dissemination research or risk communication, and I hope that can change in the future. And collaborating, it's amazing to collaborate with other scientists, but we should also be able to collaborate with other scientists that are not necessarily biological scientists as well, in addition to anthropologists, sociologists, in order to make sure that we are conducting effective sciences and we're not contributing to environmental injustice. And some of the challenges also include complex mixtures, providing both chemical and non-chemical stressors in one model. And few journals actually accept inter and transdisciplinary articles, as well as critical windows and discovery research as well. So now for a reflection period. So I know for the most part we like to finish our presentations with conclusions and takeaways, but I'm going to do something a little different today, and I'm going to end with a reflection. So I love this quote. It's marry the action, divorce the result. Now when I first saw it, it was for fitness purposes, but I felt like it drives through to what we're talking about today and what we've been talking about for the past couple days, where we need to marry the action. We need to take another step further of how do we build trust within the communities that we serve, and how do we do effective science with the communities that we would like to work with, and kind of just divorce the result of just putting that paper out there or just sharing with our peers about the amazing work that we're doing. We need to take another step. So I challenge you all to think about how you want to do this work and why you came into this field in the first place. It's not because you wanted to get NIH funding, I know that. It's because you wanted to help reduce those chemical exposures, and you wanted to help these communities reach optimal health outcomes. Why is it important? These are questions that I've asked myself just about every day since I started my graduate journey back when I was a master's student. And continuously, what kind of impact would you like to see? Because I think thinking about that impact, it doesn't stop with that journal article. It needs to take a step further, and we need to build that gap with those communities. So I just want to thank you all so much for listening to me today. I also want to thank my mentors, Dr. Maria Jose Rosa and Dr. Keisha Carroll, for their amazing support throughout my postdoctoral journey. And I'd like to thank Dr. Wright for inviting me to speak with you all today. And I'd like to take any of your questions. So thank you.